I did a session yesterday which was about the background to the project, and this is going to be a very practical session around becoming a mystery customer. And those of you that are here in the capacity of professionals or people who have an interest in this, the idea of this session is that you would then be able to cascade train, okay?
I was wondering whether it was okay in here.
Yeah.
It's looking more and more like.
No, if that's so it's passing on the message. And for those of you, hi Patrick, who are here who are AAC users, some of you have already been involved with the mystery customer pilot, and we'll have the opportunity then to share some of your experiences in that. So yeah, the aim is that the core part of this session, and the reason it's being filmed is because we hope that we'll be able to put some sections of this on the website so that it then helps people in terms of their training of a mystery customer, because it's not rocket science, but we're working through some of the sort of framework in a sense for the project. And the mystery customer part of it is very much around part of the monitoring framework. So when a business comes to us, has the training, then we want to monitor whether or not they are actually maintaining the standards. So we need different ways of monitoring it, and that's why the mystery customer part of it is important, okay? So that's just to give you a little bit of context, really. So the vision, again, and I keep highlighting this in terms of any of the training that we're doing, is around communication access, is this idea that every person should be valued, every person should be respected, and people should have the right to inclusion. And it's interesting that in the disability legislation, it says that businesses should make reasonable adjustments to be able to include everybody, including people who have physical disabilities, communication disabilities, and hearing and visual impairments, in a sense of being slightly ahead of us in terms of their symbol. So this is the sort of outline for your mystery customer workshops, okay? So if we look at this symbol on the screen, what does this symbol mean to you?
Wheelchair accessible.
Wheelchair accessible. Okay. Anything else?
Disabled parking.
Disabled parking. Yeah. Anything else?
Well, it's
A reserved space for a wheelchair on the bus. Okay.
You would imagine that if you saw that symbol in a building or something like that, that staff inside would, help out.
Okay, so the assumption might be that if this sign is seen on a building, that the staff inside that building might have some understanding of the need for support for physical access in a wheelchair. Okay. And what's interesting about this symbol is it's been around for a very long time. Apparently when this symbol first came out, it didn't actually have a head on. It was just a wheelchair. So there wasn't the sense of the person being in the wheelchair. And it's been around since the First World War, end of the First World War, but then was developed much more in the 50s. And is now one of the 10 most recognised symbols in the world. But still, when you ask a group, what does this symbol mean to them, there doesn't always seem to be a depth of understanding about really what it means. And we know that even from the legislation and building regulations that this symbol can be put in, but physically it might not be that easy to get into a building. Or the lift is only designed for the wheelchair, but not the support worker to be in there. Or the disabled toilet actually hasn't got enough space for turning in it. And so even with a symbol like this that is so well known, there are challenges around how it is monitored. So then if we look at these two symbols, these are more recent. What do these symbols mean to you? Hearing impairment, okay. Blind, yeah. Okay, so the symbol on the right, hearing impairment. Anything else about that one? Yeah, so deaf awareness or loop systems, yeah? Yeah. Interestingly enough, some of the new hearing aids don't need to be switched over to a loop. But that symbol would have a little T on it, often if it was going to be used in different settings. Partially sighted as well, yeah. What would that mean, do you think, that people might do in a building if they had the eye symbol up?
Might be some sort of a, I don't know, not a warning, but something to show that there may be steps or something like that. I don't know.
Yeah, so it could be that there's a warning about steps. It could be
tactile stuff on the walls or something.
yeah, so tactile on the walls possibly.
There might be people available to do some guided support.
So there might be some people around to do some guided support.
Braille on switches or
Yeah.
lifts.
Braille on switches or lifts, okay. But again, isn't it interesting that these symbols have been around for quite a long time and you're having to sort of pull out the themes. And I think that's part of the challenge about the communication symbol and how we educate around it, because a symbol will only give a certain amount of information, and it's the marketing, the branding, the education that comes with it that then makes it really meaningful. But then for me, it's the sense of, well, what difference does that really make for people in those settings? Does it improve their experience? Does it make it easier for them to access that environment? So the background to the project in terms of the communication access symbol was that we've got these symbols for physical disability, hearing disability, visual difficulties, but what about communication? And the background really to the project is around communication access being just as important as physical access. That if you can physically access a building but you can't communicate your needs or your wants or communicate generally within that building, it's almost ridiculous that you're there. There's almost no point in you being in that building. Or if you're able to get onto a bus but then not able to communicate what you need or want and are not given the support to do that, then the point of having the physical access symbol is diminished. So we recognise very much that this is challenging, that it's not easy, and this is very much the first step towards improving communication access out and about in the community, with the aim of improving accessibility in its widest sense. And the business who displays a symbol like this are saying that they are aiming to, trying to meet defined standards, so that in some way there has been some effort towards additional and enhanced training in that setting, and that they want to make sure that they make their services as accessible as possible. And the background to this symbol in terms of the consultation was the idea that communication is very much about face-to-face, two-way. Okay, it's about the looking and the listening. It's about understanding. It's about a total communication process. And we wanted to get away from the idea, and were guided in the consultation, that it was much more than just speech. And that's a big education area for us, because people will make assumptions about communication just on the basis of speech. And I think that's what's been interesting about this as a whole project, and what is interesting about it is the inclusion of people who have different communication challenges because of different conditions along the way. And the whole idea is around dignity and respect, but people feeling welcome in the places that they go into. So we want this symbol to become as well known as the wheelchair symbol. This is the symbol that is going to be launched through the early adopter phase, and it will be evaluated alongside the training. And the only likelihood that it might need to be changed slightly is if it has the International Standards Organisation recognition, because they do have certain criteria. But we have to prove the impact of it before we get to that stage. So, becoming a mystery customer for Communication Access UK is something that we've explored in the pilot phase of the project. So we have now 6 ASA users around the UK who have been active as mystery customers, and another 6 who have done some mystery customer visits as part of becoming more involved in the project. Becoming a mystery customer for the Communication Access UK project is part of the ongoing monitoring, but it's also been interesting in part of getting baseline data for what actually happens out in the community, because it's not all bad. And what we have found is that around the areas of the specialist colleges where there's much more activity of students going out and about in the community, because the local businesses or organisations understand more of the issues and the need to support, the experiences will be more positive, generally more positive. Whereas if someone is going into a completely different setting, then their experience might be more negative. And we're hoping that in terms of the early adopters of this, that the more obvious centres of excellence around the AAC assessment centres, departments and colleges, education and health settings where they're more used to people with communication difficulties, we hope that they will become some of the first early adopters, because they should be doing it already, and it's in a sense rewarding good practice. So when we start the mystery customer training, the question we ask is, what makes a good communication experience? And Nathan is going to contribute. Okay.
I like it when people give me eye contact when I am speaking to them, rather than looking at my communication aid. I also like it when people speak directly to me rather than my support workers. I will sometimes look at my support workers when I need help with what I am saying. Sometimes I might not have the words saved onto my communication aid. I am more likely to go back to places if I have had a good experience with communication. One shop I always have a good experience in is Lush. The staff are always helpful and speak directly to me.
Thank you. Okay. So in the consultation, we asked people what makes a good communication experience. And from that, we have pulled out the standards, the operational standards that underpin the mystery customer questionnaire. And it's comments like that which have been really helpful in shaping it. So what are the good experiences, and how that makes you feel, and reinforcing this idea that if people have a good experience, they will go back somewhere. And you have to prove your case to the businesses that there's a purpose in this. And we're talking about good communication is good business, that people are more likely to return to that organisation or service if they've had a good experience, and that we've got enough people out there to make that really worthwhile for them. So also with the businesses, it's in line with disability legislation, but actually they're probably more interested in, will it bring more customers into their service? Okay. We also then ask in the mystery customer workshops that we do, okay, what makes a bad communication experience? Are you gonna, Nathan, have you got that?
I do not like it when people do not give me a chance to speak. I find it very frustrating. I also do not like it when people finish off my sentences. People need to give me time to speak. It can take me a long time to put a sentence together, because my communication aid scans all the words, and I have to individually select them. I understand that most people have not seen a communication aid before, so I do understand why some people might not give me chance to speak or speak to my support workers. My support workers will tell people how I communicate if someone does not understand me. They will also let people know how I use my body language to communicate. I recently went to the dentist. My support team explained to the dentist how I communicate. The dentist, however, did not listen and was talking to my support staff as if I was not there. I felt very sad and angry about it. I will always give others a chance at understanding how I communicate. However, the dentist I saw did not take what my support workers told her on board.
Okay.
Yeah.
Thanks, Nathan. Now, obviously, Nathan has pre-prepared that for us in the session today. Nathan has been one of the people who's been very closely involved from the pilot, right from the beginning. He was in the first mystery customer training workshop. He's acted as a mystery customer, but he also has co-presented with the workshops to businesses that we've done through the project. You know, in terms of using the training, if you have a group of people that you are training as mystery customers, you use this as a prompt to get them to think about what is, in their experience, a good and bad communication experience, because that is the basis then for going on and using the questionnaire. Okay. So the questionnaire, as I said, was based on the operational standards that have been pulled out from the consultation. So this is just to show you that we won't necessarily go through this in great detail, but what was reassuring from the consultation was that the themes were very common that came through for the top most important things that really helped communication. And we wanted these to be as measurable as possible in a face-to-face setting. Now, we do realise that some of these things are much more difficult to achieve on the phone. They're much more difficult to achieve if you're in a service delivery setting where things move very quickly. And so in the training to businesses, that is recognised, and it's an aim, and our sort of catchphrase for the whole project that we're doing is progress, not perfection. And that's something I think is really important, because we do recognise that there are pressured situations that people are in, but it's trying to do more than raise awareness and give some tools for how that might really help. So the thing that came out the top of the consultation in terms of what might help was around being made to feel welcome in a place. And that can be to do with the environment that you're in, whether it's really noisy, whether there are quiet places around. Private spaces, if it's somewhere like a bank that you might be having a communication interaction with. It was about the thing of not making assumptions, particularly about someone's abilities. And that came out very consistently in the consultation as the top most important thing, that if you go into a place and you feel welcome, then the other things will follow. The second thing that came out as really important was this idea of being given time and patience, being not rushed or ignored. And again, you know, there are times when that's much more easy to achieve than others. But we know that particularly in terms of any communication that we're having, particularly if someone uses AAC, that time is going to be of the essence. And part of the training of the mystery customers is helping to make sure that there are stored messages that, in a sense, prompt the listener to understand what will help. So I'm using a communication aid, so please give me time. Those sort of phrases are things that we maybe use a lot in our work settings and clinic, but actually need a lot of practice out in the community, because there is a responsibility of both communication partners. And for instance, things like if you have a communication book or a communication card as a communication aid user or somebody who has a communication difficulty, that there is some way of making that accessible, so that if you're asked for it, if someone who has been trained says, have you got a card so I understand a bit more about what how I can support you better, that is accessible. Because there's a lot of work that goes on around making communication passports in lots of settings, and sometimes someone might need prompting to use that. But for the mystery customers, it's really important that they do have that as something that they can offer in certain situations. The third thing that came out was about this speaking directly to me, and it was something that we've heard from Nathan, speaking directly to me rather than to the support worker. And again, that's a bit about inclusion and making sure that the support worker is acknowledged, so they are a person too, and that you're introducing them as a support worker, but then having the interaction face to face. The idea of listening carefully, paying attention and asking to repeat if you don't understand. That pretending to understand something that is being said is much more frustrating than being asked for repetition. And check that I have understood, and that was something that we added on from the second consultation in being something around this whole idea of understanding. If it was information that was being given, have you understood that as well? The adapt to your communication, you'll see, is reflected in the ask what helps. So again, it's not assuming that you need to slow your speech, use keywords, but getting the idea of simple, easy English communication. So not making things too complicated, but responding if there are specific things that then help. And then the last theme comes out around the whole accessible information legislation and agendas that are coming through, so that anything that's given that's written has to be in the form where possible that that person can understand. And so there's some specific work going on around this, and this is much more related then to the written information. So we wanted to simplify that, because those standards are things that came out from the consultation, but they're quite hard to remember. If I asked you now, having heard that immediately, it might be difficult to remember it. And so some of what came through the training was, is there an easy way of remembering this? And so we've come up with the proposed CAUK acronym, and you've seen this now 3 times, okay? So if I take that off the screen, what's the acronym? So talk, okay. First one is time. Ask what helps. Listen. Keep trying. Okay. And it has been really encouraging that in the training that we've done over the last month, where this has been presented to lots of different groups, both people who have communication challenges and the people who support them in different settings, that it's quite easy to remember, and it seems as though it's something that can trigger these main points. They obviously need to be expanded, and that is the basis then for the business training. So we use these as the building blocks to expand it around what will help. And we're hoping that if this, is successful, then it will become as well known as the FAST campaign for the stroke management. Okay, so in terms of the mystery customer questionnaires, some people can complete these independently, but the majority of people who have been involved in the pilot would need some support for them. And so the questionnaires are to guide the people who are going to do the visits, but also the support workers in knowing the sort of things to observe and the sort of way to prepare for these visits. Because if you're just going into a shop and buying something that you're intending to buy already and then going out, you're not necessarily looking for all the aspects that we want to measure. So I'll talk a little bit more about the support workers' role. I've got 10 copies of the questionnaire here, okay, which if you could specifically go alongside, that would be great. Gregor, you've seen these already, but is everyone in sight of a questionnaire now? So on the screen there are the questions, okay. So we've had lots of different versions of these, and I don't think even now we're probably at a final version. Through the pilot part of the project, we've genuinely tried to take on the feedback that has come through people using these. At the beginning, it was more like 3 or 4 sheets and quite complex in terms of the marking system. And the request came back from particularly the colleges that actually this needed to be much more succinct and much easier in terms of the marking of it, but also that the rating scale was really important, because to have a yes/no answer about someone's experience didn't really give the potential for improvement. And so the rating scale has been sort of added quite sort of in the middle really of the project. And it has been really interesting to see then how people score according to a rating scale. The other advantage of that is that this can be adapted to use with Talking Mats, so that if people need support after their visit, there are symbols that we used in the consultation that are available on the Talking Mats website. So you can adapt Talking Mats if you're Talking Mats trained very easily. So you can see that these reflect the standards, but they're fuller than the TALK acronym. So the TALK acronym, if you think about it, is more for the businesses, so that when you're training the businesses, people who are outside the field of communication can have an easy way of remembering the acronym. But the people who are assessing need to be assessing according to the operational standards. Okay? So let's just have a practice in terms of the rating scale. So if you, for question 1, if you went into a shop and for a start it was really difficult for you to get into the shop, and then when you got into the shop you were completely ignored, what score would you give them?
0.
Okay. So it was a really rubbish experience. Okay, you give them a 0. Okay. Yeah?
0.
Okay. Yeah. And then if you went into the shop and you had been there before, okay, and it made you feel very welcome as soon as you got into the shop, okay, what score would you give them?
5.
Yeah, okay. So you're reinforcing the rating scale in the training. Okay.
5.
Yeah, okay.
5.
Yeah. Okay.
5.
So in terms of the communication part of it, if you were able to get into the shop in your wheelchair, but then when you got into the shop itself, no one greeted you, what score would you give them?
2.
Yeah.
2.
Okay, yeah.
4.
Yeah. So people will have different feelings about that, and that's fine because it's about your personal experience and how you feel, okay? And obviously the reliability of this is around going to the same place but also going to different places and getting some kind of consistency around that. And part of the learning within the colleges where we've done this is discussing those scores afterwards, and the value of apparently has been that it fits really nicely into the community programs of some of the specialist colleges. It also fits into some of the community contact within the stroke support groups, and so we have some mystery customers who are going out from the stroke community, but it also will fit into other categories. We have the mystery customer in a format that is text only or symbol supported, so it can be appropriate to the client. Okay, so your second one in terms of if you're given time to communicate, so if you go into the shop and you get your first bit of your sentence out but then you're interrupted before you finish it, what score would you give them?
3.
Okay, yeah, so we've got a 3 over there. So you see after your visit you're doing this reflecting on it, and if as a support worker you have observed different things in the course of that interaction, then you can say, well, when I looked this is what happened, and discuss it. But it's the mystery customers, oh, we're back to 0 again, are we? It's the mystery customer's view that really counts on the questionnaire. And then there's the option of writing a short text summary at the end of both of your reflections. And the more data we get, the more information from a mystery customer visit, then the better. Okay. So in terms of, you'll see it follows the standards through. So it's the idea of direct contact. Did the staff speak directly to you with appropriate eye contact? And the reason we've put appropriate contact in there is that if somebody has autism, then they often find that direct eye contact much more threatening. And so that would then be recorded, so that it might be something that, if we're talking about appropriate eye contact in the training, that we would unpack a bit more. Okay. The active listening, did staff listen well and check they'd understood? Okay. So in a busy supermarket, if someone goes into the supermarket and they're setting up like a role play situation, going in to ask for something specific that might be a bit out of the ordinary, then you evaluate whether the person has listened, whether they've understood, whether they take you to that place. You know, the level. And a lot of this is coming back as just good customer care, and it's appropriate for everyone. So it's enhancing the skills in terms of and meeting the aims of a lot of the organisations anyway, what they would be trying to achieve. So the adapting communication, as we said, this includes the thing of if they've asked you what helps, do they then adapt that communication according to that? So if you have prompted as an AAC user that wait for me because it takes a bit longer to construct my message, do they actually do that? Do they wait for you? Okay. And then in terms of accessible information, if you've asked for anything to be written down for you, how is it given to you? And this, we haven't explored yet the thing of hospital appointments, but this will be one of the things that we want to investigate. So what is the information that is given? And I think for us as an AAC community, that is quite challenging on how information is then given after appointments so that people can understand it. In terms of the accessible information standards, it also relates to, does it need to be given in an auditory form if you ask for emails as a form of communication, and how that is managed. Okay. But in terms of the written information, it's around easy read, English, and symbol supported if that is appropriate. Yeah, 5 minutes, yeah, that's fine, yeah. So in terms of the support worker, I guess that begins to make sense in the sort of things that you might need to talk about before the session, and then after the session, and how you reflect on it. So when we are doing the mystery customer training, we're saying that the role of the support worker is very much around preparation and anticipation of where you might be going and some of the issues that might come up, observation as to what goes on in the interaction. We've got some interesting, an interesting pilot that is going to happen very soon, where a staff member is going to go out with somebody who uses AAC, and they're going to see what the difference is if they stand really near the wheelchair or if they stand right back from it. And they're going to visit the same place, but to see if there's any kind of difference in that, which will be interesting. Reviewing with the person their visit, discussing it, what did it feel like, and then going through the questionnaire with them, and documenting anything in terms of extra comments on the end of the mystery customer questionnaire. So you can see it's not rocket science, but we've found it's been really interesting, the data that we've got back already, and that even if you can see a 1 point improvement, you know, that is considered progress with the service delivery. So in terms of people in the room who haven't yet done visits, the challenge really is to see if this works for you, because the feedback that we're getting is really valuable. And you can use the copy of the questionnaire that you've got here, but you can also request more of those questionnaires from Communication Matters. And then they're sent back to CM and they come to us and we look at every one of them. So in terms of the feedback and you know, evaluation, it's been really helpful for the project. I think in terms of where I am, there's more information from here. If you are in a setting where you'd like to deliver a mystery customer workshop, we're very happy to share the slides with you. and are very interesting to hear about feedback. So the pilot part of this project runs officially to the end of the year. So if it's something that you can do this term, that is much appreciated. But we're looking for the ongoing funding and support on how this might be rolled out after January. Thank you very much.